So, here are three things that a psychiatrist must consider when making a diagnosis of a mental illness. Number one, that the mental illness is not as a result of a side effect of a medication that you're using. So let's say your doctor has prescribed for you prednisolone, it's a steroid to treat your arthritis or your asthma or another inflammatory condition. Now, as a result of using that steroid for a long time, you start developing symptoms of psychosis. So it's very important in your history to reveal to your psychiatrist the medication that you're using prescribed by other doctors. Antacids that we use to treat acidity, gastritis, over long-term use, they have been associated with depression as a side effect, as well as anxiety. So these are important to mention to your doctor when they're taking history. Number two, that the mental illness is not because of a medical condition. There are medical conditions that have symptoms of psychiatric illnesses, like, for example, hypothyroidism tends to have a depressive episode as a symptom of hypothyroidism. And it's very important that the doctor sends you to the laboratory to test for your thyroid. Vitamin D deficiency, vitamin B12 have been associated with depressive episodes. And so these are important things to consider. That's why a psychiatrist might send you to the laboratory to test for these things and rule out the causes of your depression. The third one is if your mental illness is as a result of a substance that you're using, a drug such as alcohol, cannabis, cocaine, amphetamines. So these are very important considerations to make before making a diagnosis of a mental illness, to ensure that the cause of your depression is not because of a medication you're using. The cause of your depression is not because of a medical condition that hasn't been diagnosed that you have, or not because of a substance that you're using, for them to be able to say, now this is major depressive disorder, or this is schizophrenia, or this is bipolar mood disorder. It's very important to make these three considerations and thoroughly assess them and rule them out before you make a diagnosis of a mental illness.